Okay, well, I think we'll get started. Welcome to Alliance for Hope International's first webinar of 2021 from our Family Justice Center program. Thanks to Rayanne Passantino and Riley Shore, who are running the back webinar to begin 2021 to talk about this whole issue of providing virtual services in family justice centers. 2020 was an amazing journey, and I know most of us are very excited and hopeful about 2021 and leadership at the federal level and a real sense that we can navigate difficult challenges and that family justice centers in particular can figure out how to pivot, as Gail Strack likes to say, to meet the needs of both adult and child survivors. And today is one of those focus areas as we share a session that was broadcast originally at our conference this last fall by Eva Lessinger, who is the Director of Programs at the New Orleans Family Justice Center and has been working in this field for more than a decade and is just an amazingly thoughtful, insightful, and conscientious leader in the Family Justice Center movement, and is doing such great work in leaning into the challenges around intersectionality, the challenges of racial justice in this country, how those issues play themselves out in family justice centers, and the challenges we face in addressing racism and misogyny and so many intersectional issues that impact survivors of domestic violence. And certainly the New Orleans Family Justice Center, where Eva works, is one of those places that is on the front lines of all of those challenges. So we will introduce that session here in just a minute. We're also very excited to have Eva with us live to be able to answer questions at the end of this session. So Eva, if you're actually on, I'll just say welcome to you, even though we're going to play this recording here shortly. Welcome. It's nice to have you with us, and happy 2021.
Thank you, Casey. Happy 2021 to all.
As you look into this upcoming year, what are you most hopeful about and excited about?
I'm hopeful about so many things. On a personal level, I'm bringing a new life into the world. So
oh, congratulations.
That's kind of a big deal in a few short weeks. But on a national and international level, I just see a lot of potential to repair harm and come together and think about better ways of living in this world. So I think 2021 is going to be a great year.
That's great. Well, thanks for being with us today. We look forward to doing some Q&A after we play your session from the conference. As we get started today, I do want to recognize the Office on Violence Against Women and their sponsorship. We are honored to serve as the technical assistance provider for the Office on Violence Against Women for family justice centers and other types of multi-agency collaborative models. Kevin Sweeney is our program manager. We've been very honored to work with Kevin for quite a number of years now in our work with OVW, and he is such an incredible ally for us, not just in our Family Justice Center grant, but we also have a substance use grant that we're working on with Neelam Patel and Kevin, and we also have our Training Institute on Strangulation Prevention grant with OVW as well, along with a number of other grants from OVC. So thanks to OVW for their faithful sponsorship and support of family justice centers, as we now have family justice centers in 43 states and 25 countries built around this concept of wraparound services for survivors. This is going to be a recorded webinar. We are both recording this and we are playing a session, as I mentioned, that was recorded at our conference. So everything here will be available to you after this webinar. You have the ability to submit questions though, because Eva is with us live. And so at the end of the 40-minute session that we're playing from our conference, she will be able to answer any questions. So please feel free to submit your written questions so that Eva and I can address those at the end of our session today. I also want to talk a little bit about what's upcoming for us at Alliance for Hope International and in the Family Justice Center world. We are very excited that our team, which we call the HOPE team, as most of you know, we measure hope in all of our programs. We're very focused on hope as being a predictor of well-being. If you can increase hope in people's lives, you're going to increase well-being in people's lives. And so for us, this pathway to increasing well-being is about increasing hope. And hope is that ability to believe that your future can be better than your past. It's a cognitive process. Hope is a cognitive process that causes people to believe that their future can be better than their past, and that they play a role in making it so by the goals they set and the pathways that they pursue in their life. So we're all in the hope business when we talk about well-being, because hope heals trauma. And that team is an acronym for us. It's really the fundamental values of the Alliance: trust, excellence, adaptability, and moxie, which is a value that we greatly respect and appreciate when people are willing to stand and speak truth to power, when people are willing to lean out of their comfort zone and try things they've never tried before, and be courageous in both addressing challenges in their own lives and in really helping survivors to find pathways forward in life through innovative services. And it took some moxie by a lot of family justice centers this year to figure out how to adapt during COVID. So many agencies got paralyzed. So many agencies basically shut down. So many nonprofits went out of business, and businesses had to fold because they could not figure out how to navigate. And we're excited to share today some of the lessons learned in the New Orleans Family Justice Center and some of the things we've seen around the country as family justice centers have really done exactly that, invested in how to adapt and how to be courageous in pursuing new models. But we always like to give a shout out to our team at Alliance for Hope International and the work that they all do. I also want to remind you that our registration is now open and live for our Family Justice Center conference. Oh, there's a good slide that I forgot to mention. You can go back one, Riley. I do always like to give a shout out to our advisors on our team. We have a national advisory and operating board, really thoughtful, conscientious people who have helped us navigate through all of the issues of COVID and some of the challenges around racial inequity issues in this country and the disparate impacts on communities of color that we've been so focused on in recent months, and to really thinking about how to pursue reconciliation and how to pursue ways that we can not always simply depend on the civil or criminal justice system, but think of other ways to address the needs of survivors and to address accountability for those who have harmed others. And our advisory board has certainly been central to that. I do also want to remind you our conference registration is underway. We are very excited about our conference. We are going to have to go virtual. You will find this the most interesting conference I think we have ever hosted in our entire journey as Alliance for Hope International. It's our 21st annual Family Justice Center Conference, April 20 to 22. It will all be on a virtual platform, though we'll be broadcasting a number of sessions live from San Diego and a number of the workshops live as well. I encourage you to go to familyjusticecenter.org or .com or allianceforhope.com and bring a team to our virtual conference in April. It's going to be exciting. You'll see the theme, which is H7. We have tracks around hope and healing and heart and health and heroes and service provision, which we call help, and really the fundamental issues in our work, which is how to advance human rights. So we're really looking forward to this year's conference. We hope you'll join us. It's going to be a really exciting one, and we have some exciting announcements that we're going to be presenting at the conference about the future of Alliance for Hope International that it will impact all of you, that will bring you into a new, exciting journey forward on how we can all help to support each other from vicarious trauma and burnout, and really shifting some of our thinking toward retreat and sabbatical and self-care in ways that we have never done to this extent before. So we look forward to having you join us in April for our conference. And I think we're probably ready here to dive into our webinar. Just quick context, which I mentioned, we have seen amazing adaptation this past year in family justice centers. Many centers that stayed fully open, some that were able to navigate with a hybrid of services, so many different ways in which folks provided counseling for survivors on telehealth platforms or other electronic platforms, ways that people were able to provide services safely in a family justice center, even with survivors in one room and staff in another, and certainly ways that folks went online. Probably one of the biggest achievements in many family justice center was e-filing processes put in place so survivors didn't have to go to court. They could actually navigate electronically. And so many things we're going to talk about today that I think Eva will agree with me on are things that are going to be here long after COVID. COVID will one day pass. We will navigate through this pandemic with vaccines and with wise processes that will ultimately keep people safe and allow us to re-interact with each other. But I do believe that a lot of the things we've learned in this are going to be applicable long after COVID, as we essentially commit to just greater access to services for survivors. So it's my honor to just briefly introduce Eva. As I mentioned, she's been working in this field for more than 12 years, was in New York before she came back to New Orleans, and has done an amazing job with Mary Claire Landry and the whole team at the New Orleans FamilyJustice Center. We cite them as one of the model centers in the United States, and often against all odds, they do just such amazing work in systems in New Orleans that still have many, many challenges, but they have figured out how to offer hope and healing to survivors. So, as I mentioned, Eva is with us today, but we're going to play her recording from our conference in September, about 40 minutes, and then she and I will take live questions, so feel free to use the question and answer feature. And Riley, I'll let you go ahead and play the webinar now, and then we'll look forward to talking to you at the end.
Good afternoon. My name is Eva Lessinger. I'm the Director of Programs at the New Orleans FamilyJustice Center. I'm really happy to be presenting to you today on virtual FJCs. Hopefully something in the presentation will be helpful as we all adjust to this new reality that we're all living in. The New Orleans FamilyJustice Center, just to give you a little bit of background, is about 13 years old, and we've grown exponentially. We started out with about 3 or 4 staff members, and now we are just above 50. It's nonprofit led. And one of the ways that we're different from some other FJCs that I've been a part of and I've known throughout my years is that we really control our intake process and our mental health and several other services rather than partners. While we do have many partners on site, we also have grown so large because we are the ones actually delivering a lot of the services, which I know is different from a lot of FJCs out there, and which will come into play as we talk about how we shifted to working remotely. So one thing that I think is really obvious to most of us at this point is that in crisis, which I would say we are all have been in for months, there's a lot of room for creativity. There's a lot of space to think differently, think about things in a new way. And so I would just encourage you to continue with that spirit. As much as I think it's been a long, hard road for all of us, continue to be creative in the ways in which you do your work. So back in early March, we really didn't anticipate how dire this was going to be, how drastic the changes needed to be. We were really creating policies very, very, very quickly in terms of staggering staff and trying to limit exposure without realizing that the stay-at-home order would come very, very quickly. So within the span of about 3 weeks, we changed 20 different times in our policies, and then at the end had to go fully remote. So as soon as that stay-at-home order came down for us, which was, I believe, the 22nd of March, we had to move very quickly, and I think to all of our credit, pretty smoothly to shift all of our services. So we kept 2 to 3 staff at our center each day, although we officially closed our door to walk-ins. We wanted to make sure that there was a presence here. And really, there were about 3 positions that we just couldn't figure out a way to make remote. There were things, we could have them do tasks here and there, but really their position was all about watching the kids or manning our lobby downstairs. And so we really had, for the bulk of the time during the stay-at-home order, those 2 to 3 staff at the center, or at the shelter, which we also run. But otherwise, we closed down for walk-ins, but never stopped serving clients, never stopped services for even a day. So obviously, the technology was a big part of what we had to think about. So what did staff need at home? Some folks didn't really have working computers or very reliable computers. Some folks didn't really have reliable phone or internet. And so we really had to, if we were going to ask everybody to work remotely, which is what we did except for those 2 staff, we really needed to make sure that they had what they needed. So we ordered a few extra laptops, which people borrowed. We paid for people's internet. We really just had to figure out how to make it work for everyone. And those of us who were home, we had to, buy desks, and as you all know, just adjust to our home life. The technology that we invested in is different than probably some of what y'all invested in, but there's a lot of different programs out there. Doxy is what we chose for our counseling program. It's an encrypted telehealth service. There are many of them. I'm not promoting Doxy. I'm just saying what we chose to go with. Zoom, of course, everybody and their mother have Zoom at this point. We continue to use Zoom for all of our meetings and have really gotten to know a lot of the features. Resource Connect is a chat service that comes by way of our database Empower. And so for those of you using Empower, you're probably also using Resource Connect, basically just all the different things that we needed to connect with each other and to connect with our clients, which you all know is not always easy when some of our clients don't even have the technology that they need. But we really invested very quickly on the front end. We have like 2 or 3 Zoom lines, I think, to make sure that we can have meetings, the amount of meetings that we need. I really encourage everybody to look. I'm sure most of you have already done this, but look at confidentiality issues. Obviously, there can be really intense to think about how to stay safe in the midst of a pandemic with abusive partners when folks are locked down. One resource of several is an NEDV. There are many others, but their tech safety packet online is really helpful to be thinking through these issues. And honestly, as we know, confidentiality is not something you just figure out one day and then you're good. And so even if you feel like, okay, you've got your encrypted emails or your safe technology, I would continue to think about the ways in which confidentiality needs to be a factor in all of our decisions. We're out at home, do people have roommates? Do clients have a private place to share? Can people see your screens? All kinds of things that can come up. So continually asking yourself in the midst of this, how to stay safe, how to keep our clients safe. We use a lot of spreadsheets. Google is not something that we had really used before, but quickly realized that we just needed to have web-based places to talk about our processes. So it was nothing client-based, of course, no client information, just our information. So the directory, probably many of you already have an online directory. We were still kind of stuck in the last century and using an Excel file. So we quickly moved everything over to an online directory. Again, having staff at the center each day, we needed schedule help. We needed to write down our new processes for all kinds of things. We needed shared documents, and we didn't have access to our shared drive at home. And so we really relied on Google for a lot of that, a lot of Google Docs, Google spreadsheets, all that kind of stuff. So what we noticed, and probably many of you have noticed, is that we really needed to amp up our support for our existing clients. Their lives were thrown into chaos just as ours were, but with a lot of barriers. We switched to just talking about the very basics. So rent, utilities, food, people just needed to have their basics covered. We got a grant from our state coalition, which was wonderful, for direct client needs. And we immediately set up a spreadsheet of like, and a decision tree about how to decide and which families would get what, and really spent the money in about a month or less, and also started picking up food boxes from the local food pantry, and delivering them to clients, which is not something we had ever done before. We had never had a delivery system, and a couple of our staff just immediately stepped up and created a whole new food delivery system. So delivering boxes, delivering diapers. There were clients who had caught COVID and couldn't leave their house, and we'd have to leave it, on the porch. We would drop off books for the kids and coloring supplies and just basic needs. We also, one thing that we realized in doing that was the food pantry didn't really have a lot of culturally sensitive foods. So we started buying like rice and beans and other kinds of staples, and adding those to the boxes, because it was mostly like mac and cheese and just some things that our clients didn't always want. The emotional support needs also just went through the roof for our existing clients. We were, in the midst of doing a lot of counseling, in the midst of maybe doing the polyvictimization tool with people, in the midst of, all of the healing work that our counselors do, and suddenly had to just kind of switch and talk about grounding, and talk about managing stress, and having counseling sessions with kids there, and all kinds of things. And so I think just really our staff had to focus a lot more time and energy than we realized on supporting just our existing clients. The other thing we did was a survey for clients pretty early on. I think it was probably early April, asking about their basic needs, asking if they had lost income due to COVID, if they had lost their job, if the violence or abuse was getting worse, anything that they needed help with. We got a decent response for that. And luckily we had already an existing email list through our healing program of about 300, 400 clients. So that was a really easy way to disseminate the survey and for folks to contact us in need. And people who had been really stable and doing great for years suddenly fell back into crisis. And so just there was a ton of energy put towards our existing clients. But everything had to be by phone, right? So for new clients, because of course clients don't stop coming, if anything, there has been an increase. Although I will say in the beginning, we saw a pretty sharp decrease in calls, and then starting in April and certainly May and June, a large increase. So recognizing that your hotline is now your lifeline, right? We've always provided a lot of services by phone, but this was next level in terms of being available, being present, having the time to talk through and do crisis intervention over the phone, doing all your intakes by phone, everything. So for new clients, we really had to look at our hotline system, and we had pretty decent system set up before, but when everybody was home, we needed more ears answering those lines, so that folks would have the time to really respond fully to each and every client, and also have time for themselves, right? I think we're going to talk about this a little bit later, but just the nature of working from home is really different. And so we set up 3 people at home doing 3 shifts throughout the day of the hotline, and then the 2 staff were here at the center could also answer, but really that wasn't their primary job. And then at our shelter, so which already was handling the hotline. So really 5 different locations were ringing simultaneously to make sure that we had coverage. And certainly now these days, I mean, we have so many calls from new clients that I'm glad that we had kind of spread out the work. Even though it's kind of back consolidated again, people are really willing to come and jump in and help whenever they can. Obviously, documentation of the calls is really important. We always ask that everyone document calls, but now you're completely reliant on it. You can't just walk to somebody's door, you know, next to your office and say, hey, you know, I had this call, I need some help, right? So luckily our database is web-based, and so we can all see what everyone else is doing. But that doesn't mean people were documenting well. So we had to kind of amp up and make sure people were putting in the notes well. And then really doing a lot of follow-up. Again, the follow-up is really, really important when you're completely reliant on calling and emailing each other. And you can't have any of that face-to-face case review and consultation like we used to. So our intake system went fully remote for new clients. We use a product called EverSign for the consent forms. So we would do a hotline intake, and then at the point when they would do a full client services intake, what we call, they would sign the consent forms. The case manager would go through the consent forms with them. And at that point, we would start making referrals. But it felt really important to make sure we were getting those consent forms before making referrals. I think sometimes you can just want to jump in, especially in a crisis, and start doing all of that, but you really want to get the client's consent. And that too, we had to be creative because not everybody had an email address. Sometimes we had to mail by snail mail the consent forms. Sometimes people were taking pictures of it and sending it back to us. We just had to really, again, get creative. And if there were so many barriers, we would just say, okay, what's the easiest solution? Can we just drive to that person's house and put it in their mailbox? Luckily, we don't live in a really, really big city. Those kinds of things are possible. I will also say just about going to people's houses, we had a great group of volunteers that were doing the food delivery. They were our medical advocate volunteers, many of them, and some of them were just friends. And like so many communities around the country, people just stepped up and wanted to help. So we had this incredible crew of volunteers helping us do those deliveries. We saw a big need for hotel rooms, which is not something that we had previously been able to offer that much. We didn't have a lot of extra unrestricted funds to do that. And with a couple small grants and donations, we were able to really focus again on just like bare bones safety. And when the shelters were full, that required a hotel. We kept our shelter open, but we had to limit the number of people in each apartment to just that family. So there was no cross-contamination or exposure, which meant that we were always full, which meant that sometimes we had to put people in hotels. I will say that the restraining order process for us was probably the biggest challenge. You know, every community is different. Some communities have had this figured out really well for a long time. They have e-filing processes. They have remote notarizations or don't need to notarize, like we have to notarize everything here in Louisiana. So there were just multiple barriers to doing the restraining orders remotely. And so at the end of the day, despite many, many meetings and many, many coordinating attempts, the best we could do for the restraining orders was have someone come in by appointment, sit in a room by themselves, get on Zoom with the legal advocate who was home, do the order together. She would send it over to us to print out, and then the person would go to court. They physically still had to go to court to get it signed by the judge, which was really frustrating. But at the end of the day, we've learned a lot from that process, and I think we are going to improve it a lot moving forward. It just wasn't fast enough kind of change that as we were looking for, as we were hoping for. And it still unfortunately led people to having to go to the court in person. So a few reasons I think we were very fortunate that may not be the case for all FJCs. Again, we're not relying on partners for intake, which I think is the case for most FJCs. And that's not a knock on partners. Partners are wonderful. It just takes extra coordination, right? It takes extra work. If they're doing that remotely, we have full control over our intake system, which was really helpful. And it helped, there were so many little kinks to work out in the beginning that our process could develop and become streamlined and better, faster, I think, because of that. We also have a clinic, a health clinic, a primary healthcare clinic, which is amazing. It means we have expertise on site. They've been constantly consulted on every bit of this pandemic and have been really helpful. We were also able to eventually get tests, not right away, but after a month or two, we were able to do testing in our clinic. We were able to send a nurse over to our shelter to get folks tested in the shelter. That was a huge, a huge help to us in this whole process, was just having health expertise with us. We also got a PPP loan in the very first round, which was financially so critical. We have had to spend a lot of extra money, as I'm sure many centers have, just to keep things running and to get your technology needs met, and to buy plexiglass and to do tons of different things. So that has been incredibly, incredibly helpful. And then again, as I mentioned, we've got some donations for direct client assistance. Otherwise, we wouldn't have been able to provide all of the rental assistance, utility assistance, food assistance that we were able to, which was thousands and thousands and thousands of dollars that our clients really, really, really needed. So I'm really proud of us for investing in our clients and just their basic needs. And I think it really, helps to further establish a strong relationship between us. They know that they can count on us in a crisis. So as far as supporting our staff, we had to obviously adjust a lot of logistical things. People were gonna lose their paid time off, for instance, so we extended that till the end of the year. Folks couldn't clock in and out, those kinds of things. We just had to have a lot of logistical meetings in the beginning to allow for that flexibility, which is so important to making sure staff feel supported in the midst of a crisis. One thing that's amazing that came out of this time is that we actually had a wonderful intern who was really dedicated to not only our clients' healing and a lot of body-mind work, but also staff care and staff self-care. And so we were able to find some funding to do a part-time position for her to really focus on not just clients. She has a couple clients and will continue to do some of the movement-based therapies that she does, but also really talk to staff, interview the staff, figure out what they need. She's not their counselor, but she is there to support and really also be a link so that those of us in management or leadership can know what folks are needing. So we're excited. That's still, in development. She really has only had it for about 2 months, I think, at the most. But I think it's really critical that someone be paying attention to staff and what they need, and all of the secondary trauma that folks are experiencing. We continue to really highly encourage time off. I think in the beginning, all of our plans got canceled, all of our vacations got canceled, and so folks were just grinding at work, at least here, myself included, and didn't want to use vacation time to do nothing. And it became very apparent that that is not healthy, and that folks really need to take time off, even if there's nowhere to go. just to take care of themselves. And so we continue to make sure that people are taking time off. We don't force anyone, but even just a mental health day here and there is really, really important in the midst of this time. So partner engagement, I think just like pre-pandemic, it's just a lot of coordination. It's a lot of meetings, but certainly I think that goes into overdrive a bit. And those of you who have many, many, many partners, and the partners are responsible for the bulk of services, I'm sure have had to have way more meetings than you ever wanted. One thing that helped us a little bit was divvying up the responsibility for holding those meetings, which really kind of happened organically here. One of our civil legal partners just stepped up and started doing the civil legal meetings. We have kind of topic specific meetings. And so, we have one that's really about immigrant survivors, and somebody else just kind of picked that up and ran with it. And just took on that responsibility, because for those of you who have to run meetings, that it is work. It's a lot of work just to set it up and figure out what the meeting is about and how to facilitate. Obviously, the FJC is still responsible for the bigger partners meetings and for many other spaces, but it was great that other people stepped up to lead. One way to keep partners engaged for us was just to continue to offer support, ask what they needed. We had bought a ton of PPE. We had kind of over-ordered because nothing, in the beginning was coming. So we just kept ordering and then had kind of a deluge of masks and hand sanitizer. I have about 7 buckets of hand sanitizer in my office that I don't think we'll ever get rid of. It will probably take us years, but better to have more than not enough. So just continuing to offer them those kinds of things. The police didn't have masks for a while, which just, blew my mind. And so we just kept giving them as much as we could afford to give. And then also they would come to us about their clients in need that sometimes weren't a client of ours, and we would really try to step in since we had extra resources and offer that direct assistance to them. But I think, just being there for each other, seeing each other's humanity in the midst of a lot of frustration and uncertainty, and just offering some grace to each other, and allowing them to have their own process, and just supporting when possible. Obviously, there's always that measure sort of accountability and follow-up, but I think starting again from that place of we have to have each other's backs or else nothing will work is really critical now more than ever. So just a few of our lessons learned. So much can be done virtually. We never would have realized how much we could do virtually until this happened. And so I think we were all really inspired in the beginning at how quickly we were able to switch things up, and how creative we got, and how innovative we were. Just the food delivery alone, I think everybody was like, wow, like we just did it. So that was really inspiring, and I think helped to build some collective morale, collective hope. You really can't be afraid to experiment in the midst of a crisis. Like, there were so many things that we tried and didn't work and just had to reinvent constantly. I felt like for at least a month and a half, 2 months, my whole job was just this iterative process of experimentation and trying to keep things flowing and keep people feeling supported in the midst of everything. So I would also say go to the source for answers. I put that because, as we know, in our regular day-to-day operations, there's already a game of telephone happening with all kinds of things, right? The coordination is so real, and things get even more confusing when you don't have each other face to face. So, for instance, with the restraining order process, I wasn't getting a clear answer of why things were going a certain way. So I just called the clerk. I just called the chief judge. Like, I just used whatever connections I had to go to the source of whatever felt like a barrier. That can be true for so many different agencies, but I think, you know, it's easy to get frustrated when you don't understand, or you're playing this game of telephone, or all of your coordination is still hitting a wall. So to the extent that you can, just keep bringing things to the top so that you can get the answer you need in a crisis. There is no, you know, I think in regular times, we're just kind of, we don't accept the barriers, but I think we're more willing to be patient when there are barriers. And in the midst of a crisis, like, you can't worry about that. You have to figure out what needs to be done so it gets done quickly. And also just, I think, dropping like the strategizing, that can happen a little bit too. I know that, you know, when you're trying to do some systems change, or make a bigger impact, sometimes you have to really plan out your strategy, which is good. But again, I think for us, at least during the pandemic, there wasn't time for that. You just had to be direct and upfront with the people who had the answers. And if they didn't have the answer, go to the next person for the answer. Obviously, we all know that at this point, working remotely is just as exhausting, if not more, than working in an office space. There's a lot of reasons for that. Y'all have probably learned about that and talked about that, but just acknowledging, I think, is really important, to acknowledge that it's still a lot of work. It's still draining, sometimes even more so if you're juggling a family or people at home on top of all the uncertainty and fear. It's also wonderful. Some people loved it. You know, everybody was in a very different place at the Orleans FamilyJustice Center. I got really used to it. I kind of liked it after a while. I didn't want to get out of my sweatpants and come back to my slacks. So just acknowledging that everybody's going to have a different reaction, everybody's going to have different needs, and that's okay. But that it is a big deal to have to move everything remote or everything virtual. So we have to think about that as a whole system. You know, and then of course, recreating our usual welcoming, lovely, safe, warm spaces for survivors is really not possible when you're going totally virtual. And I wish I could tell you otherwise, but I think we all know that that's the truth. You have to really train your frontline staff who are answering the phone to provide that warmth, which they should be doing anyway, regardless. But have to kind of reiterate it, like, they can't see your face, they can't see you nodding, they can't see how much you care. You have to physically tell them, and work on those affirmations and holding that space, because over the phone, they're just not going to get that same impression. So to the extent that you can do video with your clients, I think it's better, like having that, at least a face-to-face human connection, even though it's not the same, is the best, but that's not going to be possible for a lot of clients either. So at least doing more check-ins, more follow-up, just telling people that you're there for them and that you care about them, can be very reassuring when folks don't have a place to go. So we all came back into the office June 1st. We did a bit of staggering leading up to that. Luckily, most of us had our own office. For folks who didn't have their own office, then we would alternate days until we could figure out if we could get them their own office. We changed our space around quite a bit to allow for everybody to eventually have their own office, thankfully. Everyone got tested, again, thanks to our clinic. Before we came back, we do a daily screening, temperature. We have a pulse oximeter, but it's not actually required. And we have wristbands, and everybody has to get screened, including partners, every single day. It's a self-screen for most people, and then clients go through the clinic. We obviously invested in lots of plexiglass and lots of PPE, cleaning supplies. We converted all of our conference spaces to be meeting spaces with clients, meeting, and really limited the capacity. We created a whole reopening protocol that changed the way in which we interacted with people walking in. So we still are about 80 to 90% remote because clients are not coming in, and that's fine. I think staff are more comfortable with the fact that clients aren't coming in that much, and a lot of the clients just aren't ready. So what we do is we allow for emergency walk-ins when folks don't have somewhere safe to go, when they don't have a phone to call from. Then we will let them up to start doing the in-person intake after screening, of course. But otherwise, we had to stop being the place that people stopped in and just had coffee and hung out and talked to us, and think we're all a bit sad about that, because we really liked being again, that safe, welcoming space for everyone. People could just come and hang out. And hopefully we'll get back there, but at this point we just feel it's just not safe to do. So most of our work is still by phone and by video with clients, except for those emergency cases. The restraining order process, again, is still in person in these bigger conference spaces, and they still have to go to civil court. So I can say we're still virtual, even though we are back in the office. I think most of our services are still virtual. Screen burnout, that kind of goes with the last slide more so, just recognizing that we spend so much time in front of our computers now, and we have to really try to get some healthy balance. We have to figure out ways to maintain that connection with clients. It's difficult, but I think the fact that we have been so solid and that we never stop services has been helpful in terms of that trust building and connection with clients. We've kind of seen this time as an opportunity to work on our training a lot, look at all of our policies, kind of just an internal focus, although we also are providing a lot of services. I think there's also more time to think about these long-term projects. We're converting our entire new staff training to online. We had previously done it about half online, half in person, and we had relied on other people's training to supplement to get the 40 hours, and a lot of just on-the-job training. But I think one of the things we're doing is creating our own 40-hour training that, regardless of how long this pandemic continues, we'll make sure that everybody's getting that same training. So, I think this time has been a time of reckoning and reflection for many of us, not only the pandemic, but our country's reckoning with racial inequality and racial injustice. A time that some of us have lost people that we love from the virus, and have had to just kind of look in the mirror and ask ourselves, is this what I want out of my life? I think people are kind of thinking in big terms, right? Although we can't plan for the future, I think there is a lot of just reckoning. And as a organization, as an FJC, as a movement, I think it's also a time to ask ourselves, what is the most important? Who do we want to be? How do we want to be together? How do we want to work together? How should we work together? I think the pandemic has exposed how we manage conflict, how we make decisions, how we support each other or not through hard times. all kinds of things about ourselves. And so although the work hasn't stopped and we have to keep focused on the work and our survivors, I also think it's really important to reflect on where you are as an agency, where you are as a community, where we are as a country, because I think, you know, we can move everything remote, and try to do everything through technology, but I think there's also we also see that there's a limit to that, and really need to think about the ways in which our work is so critical, to survivors. And so I just want to say, you know, I think from what we are seeing in New Orleans, probably what many people are seeing around the country, we're getting more and more severe cases. We have to be ready for that. We have to be ready on our hotlines. We have to have our systems set up safely so that people can contact us and get what they need safely. But we also have to advocate for more resources. We have to think about the root causes of these things, and we have to really think about how an FJC can and should respond now and in the future to future crises that will inevitably come before us. So this is my contact information. As I mentioned in the beginning of the presentation, you're welcome to reach out to me, email me. I'll try to answer whatever questions I can or give whatever advice that I can. I wish everyone good luck as we figure this out together. There is no right way to do this. There is no perfect way to do this. I'm sure you're all doing the best that you can. So keep at it and be well.
Well, thank you, Eva. Thank you for sharing that webinar for our conference last September. And thank you for being available today for some questions. We had a lot of questions come in, but thank you, my friend, for your thoughtful kind of presentation of that. So today, where are you as far as remote and in person at New Orleans FJC?
We, excuse me, and thank you again to everyone who was able to watch, and thank you, Casey. We are still mostly providing video phone support. We continue to have walk-ins for restraining orders. We still have the occasional emergency, and a few before this latest wave got worse. We were allowing some clients who felt comfortable to do, for instance, their counseling sessions in a conference room if the counselor also felt comfortable. So we were kind of trying to balance everyone's comfort. And it didn't happen a lot, but it definitely happened some. And then sort of December happened, and we're back to just the emergencies happening in person.
Mm-hmm.
Yeah.
Well, I appreciate that because it varies dramatically around the country. I mean, we've got a lot of centers that have never closed, that have provided in-person services all along, and then we've got others that have operated almost entirely remotely. Are you continuing to see that trend toward higher levels of violence? Because we've certainly heard that around the country, more strangulation, even more strangulation of children. We certainly feel like, and it may be connected to hotspot surges, but it seems like there definitely has been greater levels of violence that survivors have been reporting. Are you still kind of seeing that?
I would say anecdotally we are. We've always had really high scores on our danger assessments, but certainly through our medical advocacy program at the hospital, they've seen a lot of really serious cases. And I've had, you know, more times this past year than in the previous 4 where an officer would come to me and say, I'm really scared about this case. Can you get this person in the hotel room? When, you know, and when they say it, it doesn't happen every day. So I think anecdotally for sure, we're seeing that continuing,
Hmm.
unfortunately.
Hmm. Well, we'll dive into some questions here. I've got a lot of questions that have come in just about starting a family justice center, how a family justice center operates. So we've obviously got folks on this call that are new to the family justice center world. We are the technical assistance provider for family justice centers for the Office on Violence Against Women, and we also do fee-based services. We get hired to help communities assess where they are. We get hired to do strategic planning with communities that are interested in starting a collaborative. We work with a lot of community-based sexual assault and domestic violence agencies that kind of want to morph into a multi-agency model, which we strongly support. That's the New Orleans journey.
Mm-hmm.
And the New Orleans Family Justice Center was once part of Catholic services, and
Mm-hmm.
it really morphed into this amazing collaborative under the leadership of Mary Claire and Eva and so many others that have been a part of that process. So feel free to reach out to Rayanne Passantino or Riley Shore if you want to get more information. We've got a whole kind of toolkit to provide to you and resources to provide if you're interested in that. There are some questions that have come in about how your center has tried to address the needs of victims with disabilities, either before this or during this pandemic journey. I don't know what your thoughts or experience has been with that, but that's a question we have seen across the country, and I can make some comments about that as well. But do you have some thoughts about that?
Yeah, that's a great question. I was just reading something in BBC this morning about a guy who was deaf blind and how hard it was because he couldn't have the touch. And it's something that I think we all need to be paying attention to, regardless of this pandemic, all the time. I think we have some good systems in play, but I think we're really needing to also improve, just like most FJCs. We actually have an OVW grant right now, a planning grant on disabilities, working with survivors with disabilities through Vera as the technical assistance provider. And anybody who is considering applying for that, I think should, because it's really helpful. It's like, it's not, you don't get to directly implement anything right away. You have to kind of go through this process of needs assessment and looking internally first, so that you don't just start doing things and then make things worse, or cause harm by unintentionally.
Mm-hmm.
So even before we got that grant, we had a contract with our local, it's traditionally called Lighthouse for the Blind, but it's actually for folks who are blind and or deaf. So we have ASL interpretation through a contract with them, and we've actually seen I would say an uptick in our deaf clients. Not huge, but compared to what we often see, we have currently probably like 4 deaf clients, which is a lot for us. So we had that system set up. We don't have the fancy phones, but that's something that I think we're hopefully going to get. But certainly incorporating ASL into your language access policy is really important, in your language access protocol. And if you don't have one of those yet, I would suggest doing that. And that's and again, being deaf is not actually a disability, so I want to just acknowledge that. But as far as physical and mental disabilities, we have a pretty high percentage of our clients that suffer from a lot of different kinds of disabilities. And so the plus side of, if somebody has some technology, is that they don't have to go anywhere. If they're in a safe place, you can actually provide services from their home, which is wonderful. The downside is that sometimes they don't have a safe home, or they don't have the technology to talk to you. So I think just incorporating that into all of your thinking about the barriers that already exist, because that's like layers and layers of barriers. And sometimes you can't solve it right away, but just the basics of the shelter, or communicating by phone, or you know, getting upstairs, just thinking constantly, not just about physical space, but about how people communicate with you is really, really important. So we're on our own journey. I'll just say that. I can't say that we've perfected anything or got anything really magical, just that you have to keep it at the forefront of your mind.
Yeah, no, that's great. And a lot of centers do really work hard at trying to create partnerships with existing organizations in the community that serve people with disabilities, because it's much easier to have a partner agency with a family justice center that's already doing that work than to try to have to create it from scratch in a family justice center. So we have a
Yeah.
lot of centers that have worked really hard to find those kind of partner organizations, even if that partner may be serving people with disabilities that are not victims of sexual assault or
Mhm.
domestic violence or abuse. So definitely a great area of priority. A question came in, has staff been using personal cell phones from home, or how have you accessed that when staff are working from home?
Yeah, good question. So staff use their personal cell phones for internal, and then, to when we were remote calling each other. And then we used Google Voice with clients, which was not ideal. And we kind of went back and forth about whether we were going to get all of our case managers a work cell phone, which we didn't end up doing, but we actually may even still, just because clients love to text, and Google Voice is not ideal because you have to save the person's contact in your phone in order to know who you're talking to, which is
Mhm.
the kind of the biggest um, issue with it, I think. I mean, and it's Google, so there's also the security concerns, of course, but like for a lot of our clients, it was really, really important to have Google Voice and to be able to text and to be able to call the cell phone. And it brought up issues, I think, of barriers, or sorry, of boundaries in terms of working hours. Uh, Not that survivors really took advantage, but of course, you're always going to get a survivor that might call you at 10 or 11 a.m. or 10 or 11 p.m. Um, but yeah, that was sort of our fix. And then we all came back into the office by June. So,
Mhm.
um, and we have our like I said, that Resource Connect internal messaging system is also a web chat or an SMS system for survivors. So not a lot take advantage of it. I think because we never did a really big push for that number to get out, but
Mhm.
some have actually contacted us through that, and it's been helpful. And even just our online form in our website, we see lots of people reaching out like that.
Mhm. We've
Yeah.
had a lot of questions about language accessibility and kind of what you found are the challenge, both with limited English proficiency folks, whether it's monolingual Spanish speakers or if you serve folks with other language needs, and how you kind of have found that to be a challenge, especially with remote services.
I think the most challenging thing is when you're getting a receiving call, making sure folks really understand how to switch over to language line and conference in. We've always used language line. We have probably like 7 bilingual Spanish speakers on staff, something like that, 6 or 7 right now. So Spanish has always been the sort of the easier thing, but often they're not available to just answer the hotline whenever.
Hmm.
So we still expect hotline folks to use language line. So that's like a constant training, uh, an ongoing training thing. And then, of course, for everything else besides Spanish, you need to be able to put people on hold, find a way to communicate, hang on just a minute, and then call a language line. And but we've always had language line, not always, but for many years now. So if you don't have a telephonic service, invest in one because
Hmm.
it's probably the law to do so in your area.
Well, and we've got a lot of centers that may have 10, 12, 15 languages that they need to be able to
Yeah,
be proficient in, and it's just not possible to have all those staff available
no.
at the center or even online. So that's why I think Language Line is a good resource. I think most centers probably have English and Spanish capability. I know some centers, like we have a Russian community in Milwaukee, so they've
Mhm.
had to provide Russian language services, and it's best to have that with staff as opposed to on language line, given the large Russian community that they have in Milwaukee. But so different
Mhm.
communities do have some uniquenesses there. We've got a number of questions about kind of what you've heard from survivors about this whole remote experience. Do they feel that it's really the same as being in person? Do they respond positively to it? Do you feel like they have some needs that can't be met without just plain human contact or human touch?
Yeah,
What's
good
been the
question.
feedback from survivors?
I mean, it's been a mixed bag. I think a lot of folks really miss coming in, especially since we were offering so many things like this holistic healing stuff, ear acupuncture and massage and dance and meditation and all these cool things that people were so happy to have access to and really would have helped in a pandemic. uh, we would send them little gift bags of like, lavender balls and grounding techniques printed out. And like we did the best that we could, but I think people really miss the in-person experience. Just having a place to go, having a place to like put their kids for an hour, have a session, but I think overall, again, just staying open, staying as available as possible, trying to be a grounding force in their lives has built rapport and has built trust, and they know that when we can open safely, we will. But I think we definitely can't meet all of the needs
Yeah.
virtually.
It's interesting. Yeah, it was interesting. Just as an aside, we evaluate our Family Justice Center conference every year with Chan Hellman and the research team at Hope Research Center at the University of Oklahoma, and just finished our evaluation of our virtual conference last September.
Mhm.
And there were good outcomes in the sense that people got trained, their knowledge grew, they definitely felt like they gained competency. But we
Mhm.
always measure hope scores at our conference. And our hope scores went up, but it wasn't statistically significant. That's the first time since 2016 that hope scores didn't change from our conference.
Mhm.
And we think it's a relational piece. I mean, you can provide people services, but hope is very relational in someone's life. And if you can't be with them and they can't be with other people and be cheered for and be connected. So, I mean, we're going to try some different things at our conference this year. We're going to do much more small interaction, like you and me talking here, small groups of conference attendees engaging with each other, because definitely that one-on-one had better outcomes at our conference than just somebody listening to a Zoom webinar with 150 people or 600
Like
people
this.
in a plenary session. Yeah, I mean, if we weren't being recorded here and we didn't have 200 people listening, we could have a personal conversation and we could talk about our lives and interact probably more than if it was just 100 of us all together in a setting like this. So I do think that that's a piece that we're still trying to figure out. Text-to-text communication with survivors. We've seen some centers use live chat, where literally they put live chat on their website, and live chat is a commercial service that you can use. I don't know if you all tried live chat or even looked at something like that, but we've certainly seen some centers that have had a lot of people interacting on something like a live chat platform. Kind of just texting in general, being able to communicate with a real person at the Family
Mhm.
Justice Center. In your case, most of that is based on prior connection with someone. They first make a phone call or connect with someone, and then they end up in a texting situation.
Mostly, we do have, like I said, we have a link on our website for a web chat, but we haven't seen a ton of that.
Mhm.
Mostly people are just picking up the phone to call. But I think just as another, follow up to what you said, I think the other really big piece missing is just for kids, like our children's counseling program has struggled a lot. They do the best they can. They have shorter sessions. They do video. It's not the same. A kiddo can't sit there for 50 minutes on a screen when they're also trying to do
Yeah.
virtual learning and all of that. So I'm really looking forward to in 2021, hopefully getting some kids back and maybe doing Camp Hope and stuff like that, because I think that is a really big, it's gonna have a spiral impact on all of our work, not being able to do as much work with kids.
Yeah, we've definitely seen centers, and we ran Camp Hope last summer, actual real Camp Hope in North Carolina and California. Had to do everything outside, had to cook meals outside, had to have all activities outside. We had local Camp Hopes who went entirely virtual, and that was marginally successful. But we had a lot of Camp Hopes that just met at a public park with kids or met in a public space, and we had no COVID issues. So we're definitely pushing in 2021 toward that human interaction with kids, even if they're masked up in close space, but getting them outside, figuring out how we can meet safely in public places. So I think that definitely is a goal, because our kids so missed that interaction, and it just wasn't enough to throw kids on a Zoom connection and talk. We had some fun virtual art projects that some did with kids, where literally the supplies were delivered to kids' houses, and then they got to do stuff online. I think you all did something like that, but it's still not quite the same as human interaction. So I think that's a great goal for 2021 for survivors, for adults, and for kids. I mean, we all need that at some point. Let me just see if we've got any other questions as we're kind of heading to the finish line here, but I think we've kind of addressed most of them. There are some questions about communication platforms and systems to connect providers to family justice centers. New Orleans has a system they're using. New Orleans is also part of our pilot testing. We have built a $2 million Salesforce platform called the Hope Tech Suite that we will be presenting more on at our conference in April, but it is just about ready to go commercially live nationwide. It's funded by the Office for Victims of Crime in the U.S. Department of Justice, and New Orleans and a couple other sites, Tulsa, Oklahoma, and Clackamas, Oregon, are beginning to test the platform shortly here, and then we'll be making it available for free nationwide, not just to family justice centers, but to crime victim services organizations. We had one group in Arkansas that's not a family justice center, but asking about communication with survivors in general. And this system has been built for any victim services agency. There'll be some costs that come from Salesforce to have a certain number of licenses, and depending on how many you have and how many are using the system, there are costs for that. We have a Salesforce contractor called Exponent that also has some costs, and will be providing some TA. So it won't be in general completely free, but the system will be free because it's been federally paid for, so we won't be charging for the system. And I know you all are going to be evaluating that, like other sites, whether that's something that you can use in New Orleans. Though I do think that one of the things I like about that, and I don't know if you have any comments about this even, but one thing I like about it is that we've built in our strangulation assessments, we're building in our polyvictimization screening for survivors, we're building in hope scores, we're building in a lot of features that can really be beneficial. And I will just tell you, and Eva hasn't seen this yet, but one thing we are also building is an app. There will be a smartphone app where survivors will control all their own information, and survivors will be able, with the participation of FJC partners, to actually communicate on a platform, on a secure platform, where they control all the information with those that they're getting services from at a family justice center. So that app is in development as we speak. We're in the discovery phase with a company called Hyphenus, and we're very excited about that app being an additional resource for intake. And I don't know if you have any thoughts about that, but we definitely feel like we have to keep leaning into this technology conversation about how to create more access for survivors, more ways that they can connect with us.
Yeah, I mean, I definitely agree with that. And it's been a really interesting journey to be part of that initiative with OVC and with you all. I think I'm really excited, being someone who has to do reports all the time, to see like how I think the reports end of things is going to be really amazing. But I certainly love the idea of the app. And yeah, I just want to reiterate as well, the technology is not going anywhere. And, I think this year has exposed a lot of the technology divide that exists in our country, and that exists within organizations for sure. Some people who are super comfortable, some people who are not. and very resistant. And I think to the extent that we can kind of all keep ourselves moving along without, again, losing the human interaction and interpersonal piece is really, really important. I think survivors have had better access to our services because of this whole situation. And I think it at first was a little bit overwhelming, I think, for staff because it was more than they were used to. You know, we were really asking people to show up in person. But ultimately, it's really important to be able to just have people pick up a phone and get the help that they need. And so we have to keep adjusting to that reality. And certainly our data is a big, important piece of that. So I'm interested to see, we just started pilot testing. So the database, so we'll see how it goes.
Okay. Well, and ultimately, as Eva has touched on so many times, keep asking survivors what they need. Keep asking survivors what works best for them. We just had an interesting conversation at our staff meeting at Alliance for Hope International about languages of love. And there are languages of love in personal relationships. There are languages of love, how people experience care. And different people have different kinds of languages, and there are languages even in the workplace, how people feel appreciated, how survivors feel connected, but you got to ask them. And then you need to provide what they're asking for, rather than just creating our own systems and expecting survivors to fit into those systems. So that's certainly something that's very near and dear to those of us in the Family Justice Center world, is what we call accountability to survivors, and making sure that we're not bringing survivors into this, we're bringing survivors into this, where we can work together to figure out what best serves their needs, and not just providing services, but providing relationship and connection for them, and belonging, what we call belonging, or a community of care and hope long after the crisis. So thank you, my friend, for the great work you're all doing. I know it's an incredibly challenging journey for all of us. It gets so tiring to be on electronic platforms all day long, day in and day out. So for those of you that have stuck with us today, it's time for you now to go outside, or go do some breathing, or go do something fun, take a break, get some rest. And thank you, Eva, for your amazing work in New Orleans, and blessings on you and Mary Claire and the whole team there. And thank you to all of you for the work you're doing. This too shall pass, that we are living through, but I also see it as an opportunity for us to rethink how we're doing things. I see the challenges for us to think about reconciliation, and how family justice centers can play a role in bringing professionals together. Cops always do better work when they're side by side with advocates. Advocates do better work when they're working in collaboratives, and we continue to be calling everybody to figure out how to come together, not just the unity that President Biden talked about in his inaugural address, national unity, but agency unity in communities, and how we figure out not to compete with each other, but we figure out how to work together. And certainly that's what survivors need us to do and want us to do. So thank you. Thanks for joining us today. Thank you, my friend. Closing word?
Thank you all so much.
Anything?
Be well.
Okay. God bless. Thanks.